Good morning, good afternoon, good evening, depending on where you're listening to me from. I am Dr. Piguien Frederic, and today we are engaging into a medical education series. And today's series is entitled Pregnancy and Bleeding. Pregnancy and Bleeding. A single question: do you think that it is normal for a pregnant lady to bleed? When I say bleed, I refer to vaginal bleeding. So, do you think that it is normal for a pregnant lady to experience vaginal bleeding? To answer this question, I want us to listen to the story of one of my patients, Susie. Susie was a 19-year-old professional dancer. She was engaged into a national dancing competition and she had made it to the finals. When I say finals, obviously you imagine the amount of training, you imagine the level of focus, the level of seriousness required to make it to the finals. And she was determined to win that final because the cash prize was a 5 million francs CFA check. And she was picturing what she would do with the money, both for her and for her future baby. So she was training really hard, long, intensive training sessions. And during her training session, she noticed some vaginal bleeding, but she ignored it. She said, "It's nothing bad is going to happen. I'm going to make it to the finals. I am going to win." The D-Day came, she went to the finals and she made it. She won the national championship, the national dancing competition. And when she was called to the podium to receive a prize and to be congratulated, she felt a sharp pain on her abdomen, notably on the right side. And she could feel her pant being wet with blood. She was confused. The excitement for the prize being celebrated, being hailed by the crowd, the pain and the vaginal bleeding, but she decided to hold herself together and she went to the podium. And at the moment where the chairman was offering her a handshake, she passed out. Yes, she collapsed. In the panic, she was carried and rushed to the hospital. And at the emergency department, a doctor quickly examined and asked what happened. Doctor, she was called to the podium to receive her prize and she collapsed. Is there anybody who can tell us something about her? One of her coaches from the crowd said, "Yes, I know her. She's pregnant and she had been having some vaginal bleeding, but she ignored it." Immediately, the doctor ran some few tests, both laboratory and echography, and she was rushed to the theater. At the theater, an emergency procedure was done, and the outcome: she lost her pregnancy, she lost part of her uterus. Yes, she was pregnant, she was bleeding. She passed out on the podium, she was rushed to the hospital, she lost her pregnancy, she lost part of her uterus. What went wrong? Do you think that it is normal to be pregnant and to be experience vaginal bleeding? Pregnancy and bleeding is a common condition. 1 out of 5 ladies will experience bleeding during pregnancy, and the causes are multiple. But to make it simpler, we usually group them according to the timing of your pregnancy: early, middle, and late. If we divide your pregnancy into trimesters, so first trimester pregnancy, like the case of Susie, she was pregnant. Her pregnancy was 8 months old. That is about 8 weeks old. That is about 2 months. So her own causes are quite specific, and we will share just 4. One common cause of pregnancy, one common cause of bleeding in pregnancy, especially the first trimester. We have implantation bleeding, which means that your baby is trying to attach itself or himself to your uterus, and that attachment, in the process of that attachment, there is some bleeding, so we call that implantation bleeding. The second cause is simply a miscarriage or a spontaneous abortion. Your pregnancy was not compatible with life and your baby was cleansed by nature. That's the second cause. The third cause, which is a pretty serious one, and which is what Susie had, is termed ectopic pregnancy. We're going to talk about it later. And the last cause is called molar pregnancy. 4 common causes. Let's get back to Susie. She was pregnant, 8 weeks. She had been having vaginal bleeding and she experienced pain. She ended in an operation room. She lost her pregnancy and she lost part of her uterus. And by part of her uterus, I mean that one of her tubes was taken away because that is where her baby was located. So now we are going to talk about ectopic pregnancy quickly and we'll follow a simple plan. What is ectopic pregnancy? Who is at risk of developing ectopic pregnancy? What can you do to prevent ectopic pregnancy? So what is ectopic pregnancy? As ladies, one of the things that makes a woman is the fact that she has a uterus, and the uterus can be called the chair of the baby. And this uterus is a kind of pear-shaped organ. If you look at the shape of my hand, you have a middle cavity, and that is where the baby is normally supposed to sit. But for one reason or another, the baby may be located in a place out of this central cavity, which could be the tubes, the ovary, or out of the uterus, that is somewhere within the abdomen. So we call that ectopic pregnancy. Who is at risk of developing an ectopic pregnancy? We will share just 4 scenarios. The first is a lady who had ectopic pregnancy before. So Susie is at risk of having an ectopic pregnancy later. The second case is a lady who uses intrauterine device as a method of contraception. So this refers to a scenario where an object is inserted in the uterus which is intended to prevent pregnancy. The third case is a lady who has a pelvic inflammatory disease like chlamydia, gonorrhea, syphilis. Such lady is at risk of developing an ectopic pregnancy. And the last is a lady who had a surgical procedure following an abortion like curettage. A hooked element was sent into the uterus to scrape off the remains of an abortion. So 4 scenarios: previous ectopic pregnancy, history of PID, history of use of intrauterine device, and history of surgical uterine procedure. How can you suspect that you have ectopic pregnancy? This is very important. You need to have been pregnant. Yes, a pregnant lady who has vaginal bleeding and who has abdominal pain, usually sided, right or left. There is a high chance that she will develop or that she has an ectopic pregnancy. What to do to prevent this condition? Firstly, as soon as you miss your period, do a pregnancy test. If you're pregnant, get to the hospital and start your antenatal clinic. As soon as you realize that you're pregnant, start your clinic. Secondly, bleeding and pregnancy are not compatible. It is not a common event. It is not an event that should be taken normal. If you're pregnant and you're bleeding, get to the hospital, see a doctor, be checked, let investigation be done, and let the doctor tell you that, madam, there is nothing serious or there is nothing wrong with you. Don't sit in the house and assume. She lost her pregnancy, she lost part of her uterus. This is a beautiful story. In another scenario, she could have died. Yes, she could have bled out into her abdomen and lose her life. She could have lost her uterus. So it is not a joking condition. Pregnancy plus bleeding equals medical consultation, at the end of which you want to listen to the conclusion from your doctor. This is the cause of your bleeding. Very important. We have come to the end of our medical series about bleeding and pregnancy. I hope I was able to share some useful information with you. Take home message: bleeding in pregnancy is unusual. It warrants a medical consultation, at the end of which you should know the cause of your bleeding. Thank you very much for your kind attention.